This is Core Conversations with Natalie Baggio.
Welcome back to Core Conversations. I'm Natalie Baggio, and this episode we are continuing to discuss workforce and how we're investing in our communities to ensure that we have access to care.
Thank you.
Would you mind sharing with the community your name and tell us a little bit about yourself?
Sure. My name is Moniica Woods, and I'm a certified surgical technologist here at Corewell Health. And first and foremost, I love serving the community and helping others. That's my passion, myself and my family. I do love volunteering in my community, spending time with my family, and just continuing my education and giving back as much as I can.
Well, we greatly appreciate your commitment to this community, and I know how much of an impact you make each day in your role at Corewell Health. And being a surgical technologist is not always an easy position to have.
No,
Yeah.
It can be very challenging.
And it would be great if you would be willing to share with the community what a day in the life of a surgical technologist is.
Okay, sure. So as a surgical technologist, typically we help run the OR. We maintain sterility. We help prepare the room for surgery. We anticipate the surgeon's needs. And our main goal is to make sure each procedure is as safe as possible for the patient. And we all play an important role in there. And teamwork and precision is everything that comes together as a whole. And what I love most about being in the operating room is that even though the patients may not never remember me when they wake up, it's the fact that I had the opportunity to help save or improve their lives. That's very important.
Yeah, so you shared a day in the life in like less than 20 seconds.
Yes.
But that sterility part,
Yes.
anticipating the needs,
Yes.
that is a lot of responsibility.
Yes.
Because that's how we have amazing outcomes. Patients don't have infections.
Yes.
And you're able to move the surgery along seamlessly. So the doctor can keep doing what they need to do, and you're right there behind them.
Yes.
How did you decide to start in surgery or become a surgical technologist?
Well, first, I always knew I wanted to work in healthcare.
Okay.
And I just have the passion for helping people.
Uh-huh.
And losing my father at an early age to pancreatic cancer kind of helped set the tone for what I wanted to do. It was a very profound impact on my life. So just going through the emotions at an early age, losing my dad and having various caregivers that were very compassionate and helping us through the experience, that just kind of solidified for me what I wanted to do, just spend my life helping others.
Yeah, because you were able to watch other people help your father,
Yes.
and you just instantly felt connected to that.
Yes. Yes.
Yeah, because it is when you watch that experience, and it's different than watching it and feeling it. You watch it every day now.
Yes.
But it really does have like a strong connection where you can build trust, and you really can make a big difference in someone's life.
Yes.
And that's what you're doing now
Yes.
every day
Yes,
in
and I
some of
love
the
it.
most vulnerable aspects of people's lives and scary times when you talk about surgery. So you're
Yes.
helping families, but you're also helping teams
Yes.
during very intense times as well. And people show up every day and are in these situations where they have to help save lives. And that's what
Yes.
you're doing. So you've been in the surgery department and you just went through the program a few
Yes.
years ago. Could you share with the community what it was like to go through that and how it's changed what you do every day?
Well, it definitely helped build my confidence even more. And I like to say I've grown more professionally. And even though I had already worked as a surgical technologist, it was very awesome to have the experience to be able to do that and to inspire my peers and my coworkers, which were very supportive, as well as my family. But just giving the opportunity from my educators and my leaders, that was a very happy point in my life, because going through some challenges, and when my department leader came to me and said, "This is what we're doing. This is the program that we're going to do. Are you interested?" I said, "Yeah, sign me up." I definitely want to do that, just to further advance my career, I love it. It's been a great journey.
Mm-hmm.
I've learned so much. I had so much support.
Yeah.
So many people encouraged me to just keep going to pursue my goals.
Because it is a lot to balance
Yes.
work, school,
Yes.
and then the practicalities of
Yes.
being able to work for clinicals in the same department.
Oh, yeah.
Right? That you're studying. So
Yes.
that has to be a little bit of a shift. But did you find that experience really helped escalate or accelerate your learning, I guess?
I think so, because even though it was challenging coming to work every day, because we also take mandatory call and whatnot, and then I'm the head preceptor, I train all the new orientees that come in. So yes, it had its challenges, but it was very rewarding.
Yeah.
Because I knew what the long-term goal was for me, that I was making a difference and also inspiring others and, setting that example for anyone that might be interested in the program in the future. So, yeah.
I like how you said it built your confidence and
Yes.
elevated your professionalism.
Yes.
I think anytime that you have an opportunity to interact outside of your normal environment and you're looking for how you can be stretched or how you learn from others,
Yes.
that's kind of what happens, right? It's you do grow. You might grow professionally, you may grow personally, but I love hearing that was one of your takeaways from the
Yes.
program
Yes.
because you had a strong clinical competency already because you've been doing this for so many years.
Yes.
But now to be able to marry that with now having the actual certification, and that's what probably helped lead to building some of your confidence.
Yes, I am so excited. It's been a long journey, but just being able to be in the pipeline program and to continue my education and to be able to be eligible to sit for the national certifying exam. Oh, that was just so awesome. That was a great experience. And then becoming a certified surgical technologist, just to get that credential, that meant something to me. It's very big.
That's great.
Yeah.
Would you say that it took a lot of time to study for that
Yes.
exam outside of work?
A lot of time to study, hard work and dedication. And I always tell people, if it's something you want to do, you first have to want it. Because if you want it bad enough, you're going to do whatever's necessary to achieve your goals.
You're going to make the time.
Oh, yeah.
You're going to prioritize it.
Oh, yeah. Oh, yeah. So I did a lot of that and working and then training new people, but it all played off in the end.
So how do you approach training new people?
So I always tell them my story. I always use myself as an example. And, I let them know, hey, I started off in labor and delivery as an OB tech for years. And then I wanted to explore surgery, so I went to the operating room. So I always let them know, first and foremost, if you come in experienced or not, it's okay, because we all have to learn. Nobody learned that job overnight.
Yeah.
And it's very challenging, but I always let them know you're going to be okay. There's plenty of resources, and we're always available to help people. So you're never alone.
I'm sure extending that support makes people feel more comfortable and included right away.
Yes.
With us launching the innovation around the virtual reality and training in the OR, outside of the OR, have you seen that boost people's confidence?
Yes, I think is a huge asset. And the fact that we have the Incision Academy, because I went through that in the program as well. So I think that is very wonderful. The best thing that we could have done to help the orientees. And I just want to see more people join the program.
Okay.
Yeah.
Well, let's work on that.
Oh, yeah.
Because we need people to have this level of inspiration. But, even when I became a nurse, the OR was somewhere you couldn't really view very easily, right? So you don't really know what happens in the operating rooms unless you have an opportunity to have a look behind the curtain, per se. And I think with this new virtual reality technology, that's giving people an opportunity to see what it's like and understand how many different instruments that you learn and how challenging but yet rewarding that that career path can be. So,
Yes.
yeah. Well,
Now, one thing that we
Uh-huh.
do when we're interviewing, we do give people the opportunity to come and shadow the OR just to
Okay.
see if
Yeah.
it might work for them, to see if they like it. Because I know it can be intimidating sometimes.
Yeah.
But if they can see it firsthand and do a walkthrough with us, they will have an idea.
Yeah.
Yeah.
That's a great idea.
Yeah.
To give people that visual experience.
Yes.
How do you think we should go about getting more people interested in this profession?
I would say, firstly, to be more supportive
Okay.
and more resourceful,
Okay.
whether it be more advertising.
Mm-hmm.
I know a lot of people still comes to me talking about how they were inspired when they saw my video
Yeah.
when I received the Impact Award. So if that will help inspire people, that's a great thing.
Mm-hmm.
I just feel like if we go out into the community and talk to people more, get them to feel more open and comfortable so they won't, feel like, be in a doubtful way, saying that, this may not be for me. Because
Yeah.
sometimes people do that.
Yeah.
But if we make them feel like, well, we're here for you. We have the resources for you.
Mm-hmm.
Let's get together and see what we can do to help you. I think that would be beneficial.
Well, thank you for sharing that. And I think today this conversation is one step to getting this information out to our community and letting people know that we have programs to help move our community and our other employees through certified programs that they're interested in and pursuing a career in healthcare. But it takes people like yourself in the hospital training. You have this intrinsic motivation and passion that is electric.
Thank you.
And that also helps build programs and inspire people. So thank you for being here today. And is there anything else about your story you'd want to share with the community?
I would tell people that are interested in joining this program,
Mm-hmm.
if you have the heart to serve people, then you belong.
Okay. I love that.
Don't let fear or self-doubt stop you.
Yeah.
And I would also like to tell people that healthcare has so many wonderful opportunities to help make a real difference in people's lives. Just take that chance.
Yeah. I mean, because when you work in healthcare, anyone who walks through any of our doors, you're making a difference in their life.
That's true.
Mm-hmm.
Every day.
Well, thank you. And congratulations on your Impact Award.
Thank you so much.
I mean, that speaks volumes to
Thank you.
and a strong testament to what you do and how you make a difference every day. So thank you for being in this community. Thank you for choosing to work at Corewell.
Thank you.
And continuing to help save lives each day.
Thank you. I appreciate that.
Thank you for joining us on this episode of Core Conversations.